Hello, today we'll be talking about assessing chronic periodontitis. The beginning of the slideshow will be a little bit of review. I thought it was important that we had a clear understanding of what chronic periodontitis was so that we could create individualized patient care plans. So again, like I said, the beginning will be a little bit of review. What is chronic periodontitis? Chronic periodontitis is a complex infection as the result of an interaction between the plaque biofilm that accumulates on the tooth and the body's efforts to fight this infection. The body's host immune response plays an essential role. It begins as plaque-induced gingivitis, a reversible condition. Plaque-induced gingivitis left untreated may develop into chronic periodontitis. Now, chronic periodontitis includes inflammation within the supporting tissues of the teeth, progressive destruction of the periodontal ligament, loss of supporting alveolar bone, and it does progress at a slow to moderate rate. It is common in adults over 30, but may also affect children and adolescents. Chronic periodontitis is also known as adult periodontitis. Chronic periodontitis is also the most common form of periodontitis. It does result in irreversible loss of attachment and bone. There are a couple different forms. They are recurrent and refractory chronic periodontitis. Now, recurrent chronic periodontitis is where new signs reappear after periodontal therapy because the disease was not adequately treated and/or the patient did not practice adequate self-care. Refractory chronic periodontitis is a chronic periodontitis that does not respond to therapy despite adequate treatment and patient self-care. Some general characteristics of chronic periodontitis include alterations in color, texture, and size of the marginal gingiva. The tissues can appear pale pink, red, or purplish in color. The gingival margin can appear to be rolled, and then the interdental papilla can be blunted or flattened. It is important to note that the clinical appearance of the tissues is not a reliable indicator of the presence or severity of the disease. Some more general characteristics include bleeding, crevicular fluid, and exudate. Gingival bleeding is common and can be spontaneous bleeding or in response to probing. Increased flow of gingival crevicular fluid or separation from the periodontal pockets is also common. Another characteristic of chronic periodontitis is mature supra- and subgingival plaque biofilms and calculus deposits. Teeth with chronic periodontitis usually have a very complex and thick deposit of plaque biofilm on affected tooth root surfaces. Another characteristic is loss of attachment. This could include the following: loss of alveolar bone support to the teeth, periodontal pockets or recession of the gingival margin, furcation involvement on multi-rooted teeth, and tooth mobility. And lastly, a characteristic is localized or generalized inflammation. Localized is less than 30% of sites affected. It may involve one site on a single tooth, several sites on a tooth, or several teeth. Generalized inflammation is greater than 30% of sites affected, and it may involve the entire dentition. Some contributing factors for chronic periodontitis. It may be modified by and/or associated with local factors such as faulty restorations or the patient's self-care routine. It may also be modified by systemic risk factors such as smoking, uncontrolled diabetes, systemic diseases, stress, and medications. The clinical assessment of chronic periodontitis. Now we're going to get into some signs and symptoms. Usually this disease is painless. Some things that could be noted are swelling, gingival bleeding, periodontal pockets, bone loss, tooth mobility, separation, moderate to heavy deposits of plaque biofilms and dental calculus. Generally, the patient may first become aware something is wrong when they notice bleeding while brushing. The patient may also complain of food impaction, sensitivity to hot or cold due to exposed roots, or a dull pain radiating into the jaw. Treatment of chronic periodontitis. It is important that the patient consult with the physician if any systemic risk factors are present. We'll also do an evaluation of any local risk factors and educate the patient on how to control or eliminate these risks. Behavior modification and a patient-specific self-care routine are also established. We will initiate non-surgical periodontal therapy, and a reevaluation will be done in 4 to 6 weeks. At this time, if the patient responds well to the non-surgical periodontal therapy, perio maintenance would be appointed. If those sites are non-responsive, this is when we would refer on to a periodontist for surgical intervention. Some of the treatment goals for chronic periodontitis include significant reduction in gingival inflammation, reduction of dental plaque, reduction in probing depths, and prevention of further attachment loss. And my citations.